Yeah, so I read the article about spirituality. This is an article written by Mary Helming, and the purpose of the article is to show the importance of spirituality in patient care, specifically when we start practicing as nurse practitioner. So what she did at the beginning, she tried to explain and the lack of the use of spirituality in our world. When I say our world, in our practice, and she also at the beginning make a big difference or a clear difference between religion and spirituality. And religion, according to Mary, is a set of belief and followed by a group of people. And when spirituality is a little bit broader, and spirituality is your connection with nature, your connection with yourself. The way you deal with a human being, you treat the animal, the plant, the sun. You appreciate the rain, and that's mainly in spirituality. So even though somebody can be religious, but they can be their religion can be supported by spirituality as well. And the other thing she did, she managed to do some kind of review of the few research that we have as nurses in spirituality. And she mentioned that the physician are two step above or ahead because they already include spirituality in their program. So she think nurses need to do the same thing. So and further down, they came. She came with a scale. There's a scale, and so when you have the patient, you should be able to use the scale to appreciate the level of spirituality, the need of the patient, you know, and so based on that level, so you know exactly the need of the patient and needs that you will include in the plan of care, you know. So they believe if spirituality is used, and we will have better outcome because we cannot continue to consider the patient as symptom and illness. The patient is a whole package. That's what we practice in nursing, and we call that the holistic nursing approach. So is the view of everything. Okay, the patient culture, spirituality. We manage to include everything in the plan of care. And well, as a nurse practitioner myself, I would use spirituality in my practice, and I would do the assessment using the scale. And what I would do, I would refer the patient to, some kind of spiritual father to get help. You know, it can be a priest, a pastor, or anybody else. And even myself, as a spiritual being, I would be able to use my knowledge to help my patient. So that's my understanding of spirituality.